Okay, welcome back. Let's look at some of these sex hormones. Now, when we talk about the reproductive tract, right, the reproductive tract has two main parts, one of the female, one of the male reproductive system. So we have to look at the ovary of the female reproductive tract and the testes of the male reproductive tract and look at what hormones they produce. So the ovary together with gonadotropic hormones of the anterior pituitary. This now we're talking about the ovary producing estrogen and progesterone. Now these are steroid or cholesterol based hormones, as is testosterone, right? You see the word steroid there, sterone, progesterone, steroid, estrogen, steroid based. But in order to make these, you need cholesterol. Okay, cholesterol, testosterone, right? So together with the gonadotropic hormone and anterior pituitary, it regulates the female reproductive cycle. It's involved in maintaining pregnancy. It prepares the mammary glands for lactation, and it's going to promote development and maintenance of the female secondary sex characteristics. Relaxin is going to increase flexibility of the pubic symphysis. Remember, the pubic symphysis, that is fibrocartilage between the two pubic bones, it needs to allow for relaxation of that during pregnancy to allow for the pelvic brim to expand because there's going to be a baby in there, right? Relaxin also helps to dilate the uterine cervix during labor and delivery. What is inhibin? Well, we see the word inhibit. So it inhibits the secretion of follicular stimulating hormone from the anterior pituitary. Now, what about the testicular hormones? So this is primarily, we're talking about testosterone. This is going to stimulate the descent of the testes before birth. It's involved in regulating sperm production, and it promotes the development and the maintenance of the male secondary sex characteristics. And inhibin again, just like inhibin from the female, it inhibits the secretion of FSH, follicular stimulating hormone, from the anterior pituitary. So FSH is really involved like with sperm production, and FSH is also involved with the egg production. When we come back, we'll talk about these miscellaneous hormones.